Excellent. PS Kenya is currently very active in the space of integrating gender-based violence and reproductive health services. Yes. This is a unique space because at health facility level, sometimes you may find that a lady who comes in with with a case of gender-based violence is not counseled on reproductive health and the options that she can do to prevent herself from getting pregnant and ensuring that any unintended pregnancies are dealt with at a very early stage. So what we are currently doing as PS Kenya is integrating gender-based violence and reproductive health in 13 counties, yes, where we have partnered with Gender-Based Violence Recovery Center through support from Danida, the Denmark government that has come in to support PS Kenya and also Gender-Based Violence Recovery Center towards ensuring that we are ending teenage pregnancies, that we are ending maternal mortality, and also ending harmful traditional practices. We are also very active in HIV, yes, where we have HIV self-testing in the private sector. So why I say this in the private sector is that we are working with local pharmacists or chemists in ensuring that they have high quality products, HIV self-testing kits, and releasing this or getting this out there to anybody who wants to test themselves at the comfort of their homes. Yes. So we have partnered with organizations like MyDawa to deliver these HIV self-testing kits to the consumer's preference or to the consumer's point wherever they would want to access this commodity. We are also working very closely with Nairobi County and also in Kisumu County in the same space, in HIV self-testing, and at the national level, at policy level, bringing other stakeholders together and ensuring that there is a steady supply of this commodity in this country. Yes. Another space we are very active in is in family planning, reproductive health, where we are in 12 counties in this country, to ensure that the healthcare workers are adequately trained, that they know how to administer family planning commodities. For example, if it's pills, injection, intrauterine contraceptive devices, and also any choice or any contraceptive option that a client would want to access for themselves. Yes. Those are spaces that we are very active in. We are also active in TB space. In TB, here what we do is that we ensure that there's active case finding, yes, in the private sector. And in the private sector, where we have realized that 50% of Kenyans access health services through the private sector. Why I say 50%, and it may seem like a very high number, it actually isn't, because if you think, if today Elijah is to get a headache or to fall sick, the first place that you access is the local chemist, the local pharmacy. It's actually that's true. That's the private sector. Exactly, yeah. Even the small clinics, if you're referred to somewhere else, it's likely to be another clinic near there that is owned by a private entity. Yes. By the time you end up in a government facility, sometimes it's much later when your disease has advanced and when the burden is very high at household level. So we work with the private sector to ensure that we are harnessing the strengths of this private sector, ensuring that they get the adequate capacity, they're adequately trained. So in TB specifically, we ensure that there's active case finding, and also there's this very stubborn drug resistance TB, yes, that take months or even years to treat. So we identify clients. For example, we are in Nairobi County and Mombasa County in ensuring that drug resistance TB, that clients who have been diagnosed with drug resistance TB complete their treatment. So we've hired adherence counselors, because somebody who is required to take medication for 12 months or 18 months or even 2 years, depending on the severity of that illness, they require support. So who is this person talking to this client? Sometimes you may end up feeling like you're alone. So we hire adherence counselors to walk the journey with drug-resistant TB clients until they complete the treatment as well. Yes. Another space where we are very active in is social marketing of health commodities. Yes. And that's a big chunk. I think we'll come to that shortly. We'll come back to that shortly. Yes.
All right. Pretty much. Just want to take you back a bit before we get into the social impact. Let's go back a bit to whatever it is you spoke about when it comes to healthcare professionals training as well. Just from where you sit at this particular time, would you say that when you look at our local healthcare system, that we are at par with the international standards that are required for a performing healthcare sector. I'll take you back. We've seen headlines in this country where maybe our doctors have been taken out for benchmarking, or the government has been forced to hire external doctors to actually come in and support the healthcare system in the country. Would you say that we're lacking? When you say training of healthcare professionals, what do you exactly mean?
Yeah, so capacity building of healthcare workers is essential because in the medical space, there are always new guidelines that are being developed. There are always new innovations that are in that space. So what we do is ensure that these new innovations get to all levels. Sometimes this innovation may be left at this high level, or the private sector, or even the government, who end up being supported with a lot of trainings. So we target those small clinics, 111. Yeah. Some of them, the last time they were trained is when they came from school, 10, 20 years ago. Yeah. So that's the caliber of clientele that we target. And that's what makes us unique as well as PS Kenya, because we strongly target the private sector, especially the stand-alone clinics that are left out from the traditional government trainings. And yet, many Kenyans access healthcare services through them. So when I talk about capacity building, what I mean is the trainings as well, and also equipping them with the necessary equipment that they need. For example, looking at family planning, not only does this healthcare provider need the skills, they also need the tools to be able to deliver the services